All right, I'm not going to ask you if it's right or left, but I can point out a couple things. The head of the femur, right? I think I can also, you know, I can point to spongy bone and compact bone, right? I can also point to the diaphysis and the epiphyses, right? Got it?
Mm-hmm.
All right, and I'm not saying I'm not going to pull the models or whatever. I'm just saying that's what I see here. Okay? All right, any questions? Don't really see anything else that stands right out. I mean, I will not, so please don't misunderstand me. I'm not going to point here and ask you to identify the epicondyles. I'm not. But this right here is clearly the greater trochanter. There and there. Okay? All right? Got it?
So if you show,
If I was going to ask something there, I might ask for, like, what is this? Answer would be the pectoral girdle.
Okay.
All right, the whole thing. But what you can see clearly here is the head of the humerus. See it right there?
Mm-hmm.
All right, that's about it for this one.
Okay.
All right, and what I'm not going to have time to crop them for you, but you know you can get them on your and then enlarge them yourself. All right. All right, so this one here, okay. What do we see that's pretty obvious? Well, I see the tushy. I see the gluteus maximus there. I see a couple of the hamstring muscles. This one is the lateral one. I can't remember them right off by adductor long, whatever. This one here and this one here are obvious. Okay. I also see the gastrocnemius muscle here and here. That's the left one. That's the right one. Right. But I do see clearly, largely right here, the left deltoid muscle and the left triceps brachii muscle. Okay. This muscle right here, I'm not sure about this one, but this one's from here. I think I have a better one of it. That's the latissimus dorsi, the right one. All right. And there's a portion of the trapezius, but I'm not going to ask you that because it doesn't look clear. All right. But left deltoid, left triceps brachii, right gluteus maximus, right and left gastrocnemius. All right. All right. So gastrocnemius.
Gastrocnemius.
Say it again.
Gastrocnemius.
Make sure you spell it right. Okay.
but it's not spelled with a K.
It's not
Not the
spelled
K,
with
it's with a C. All right. All right. Okay. This one here. There's one. Okay.
Hey.
Don't see anything else that I would ask.
Excuse me. Oh, I'm so sorry. Give me the. I'm sorry. She just hit you today.
All right. So this one here. This is of an old person. What is clear again is the right deltoid muscle, and then the right biceps brachii muscle. You can also see down here the vastus lateralis. A little bit of this one here, but then here's the vastus medialis. All right, but I think I have a better picture of that one. But that one's kind of clearly showing that. You can't quite see it there, the muscle, but that would be the frontalis muscle. I don't know if that was on my list or not.
It was.
All right. Okay, so. All right. Nope. Glossus. All right, there you go.
Glossus.
I have to remember that. That's a good one.
Glossus is a good
There
one
was
for
a
him to
Yeah,
remember.
tongue, yeah. All right. Okay.
Posterior.
Why?
It's got the vertebrae.
There's the vertebrae, right? There's the body of a vertebra, right? And there you can see the muscles right there. So that's anterior. There's the sternum right there. All right. So this is fair game.
That's fair game.
Yeah. If I want to.
Oh no.
If I want to ask posterior anterior, I can, but I can also ask you body of a vertebra and the sternum in that picture.
You got
all right?
it.
But again, clear there. There's the diaphragm right there. So that's pretty clear.
Could do the middle.
Nah, it's too.
It's cut up
We
better.
could look at it, but it's like to a naive student, you know, it's like unless you see these thousands of times, it's not going to look so clear to you.
All
All right, so no. Here you do see the vastus medialis, the rectus femoris, and then right here is the vastus medialis.
Other one's the lateral.
This is vastus lateralis, but this third part makes it confusing. Now this one's a good one. This muscle that goes across there, that is the gracilis.
Gracilis.
Right there. That's you use that to cross your legs when you want to bring it over.
Gracefully.
Yeah. So that's the gracilis, not the penis, the gracilis. All right. No. Okay. Pectoralis major muscle. Oh. And pectoralis major. And right here and here are the sternocleidomastoid muscles. They're
Okay.
detached, but they're very clear. That's the left sternocleidomastoid muscle. There's the right one. All right. Can't quite see it. Orbicularis oris. It's not clear there. But you can see the orbicularis, the right orbicularis oculi muscle there. All right. Okay, so this is showing, this would be the external, the left external oblique here and there. There it is, continuing there. This is the rectus abdominis right there. And that white line is called what?
Linea
Linea
alba.
All right. Here it's very clearly showing the left and right serratus anterior. Now, do you know what a serrated knife looks like? It's got little serrations. Well, that's why it's called that, because it looks like that from the side view. But that's the left serratus anterior and the right serratus anterior. Okay? Again, I don't know if anybody heard me say this. Like, what are these all about? It's like, so yeah. Now, I take a picture. Okay, so here is, so you look at these pictures, you're going to say, this is the one Dr. Siegel's going to point to if he wants to ask me leg muscles. It's very clear, right? There's the vastus lateralis, the rectus femoris, and then tucked in here, right here, is the vastus medialis, all right? So it's showing that. Not sure about this one. I have to double check it. All right. Oop. Gluteus maximus, right and left, and this is showing the left gastrocnemius there, and these are the hamstrings are not so clear, not clear. Here is the diaphragm right here. This was my picture. Okay, this is very clearly showing the right latissimus dorsi muscle. It's the muscle you use to swim. It's what pulls your arm down forcibly. And then when it hits you. All right. So that's that one there. Can't see it again, but there is the right masseter muscle. There's the parotid salivary gland, but it's not clear on that one. But this clearly shows the right deltoid, the right latissimus dorsi muscle, and the right serratus anterior muscle right there. This one here, I can show you, and this is the head of the femur here, and right there is the greater trochanter. All right, this would be the diaphysis of a femur, but you know, I'm just showing that. But that one's kind of a different way of showing the head of the femur. Okay, you can also see spongy bone in there as well. What bone is this up here?
Or the alien.
The ilium, or just say coxibone. Now, for this bone here, this concavity, this depression, where the head of the femur fits, is called what? Oh, I'm sorry. Acetabulum. Very good. So this is kind of cool, because I think in my former teaching life, students would go, "You tricked us. You tricked me by asking that." It's not a trick. There it is. Pretty clear. All right. So acetabulum. All right. Same one again. Same one again. Okay, so here you can see the right and left orbicularis oculi muscles. And I don't know, can't say anything about that one. Here are the two, right and left, pectoralis major muscles. There it's very clear, the gracilis muscle right there, the left gracilis muscle, all right? Make sure you say right and left on these. Like I say, 3-word answers get you a 10 out of 10. I'm not sure about this one. The pectoral girdle is shown very clearly here. Did I have temporalis as one of the muscles?
Yes.
You can kind of see it there, and then there's the frontalis muscle there. Here is the right sternocleidomastoid, but I would not use that one to point it out to you. It's clear in that picture, but if I have a clearer picture, I will always point to one that's better. Now this one here, I took this picture because I saw this. Here is a good one to ask you, first of all, what's the bone?
Femur.
Femur? No, wrong.
Wrong?
Right femur.
The right femur
Right
bone,
femur.
okay? What is this part here? What is this part? That's a little jaggy. What is this part here?
The condyle,
Okay, so I'll point to this down here. This part down here would be the what?
Condyle.
Not quite right.
The
Lateral.
Lateral.
Right, the right lateral condyle.
Right lateral condyle.
And here's the left lateral condyle, and you can't see it clearly, but right there, that would be a bump. That would be the right lateral epicondyle. Okay?
Okay.
So that's why I took the picture, because it's kind of not a tricky way to ask it, but there it is. It's very clear. The two condyles of the right femur bone. Okay? Now you could say lateral condyle of the right femur bone. That's just as correct. You know what I mean? Here's that ligament there. Probably a lateral ACL. No, not CL. It's not crucial. Anyway. So that is it.
That's a wrap.
That's the